Next, ethical challenges of data sharing. Introduction. Data sharing in healthcare is vital for improving patient outcomes, research, and public health. However, it presents significant ethical challenges related to privacy, consent, equity, and responsibility that must be carefully managed to respect individual rights. Next, key ethical challenges in data sharing. Firstly, privacy and confidentiality risks. Sharing data increases the risks of unauthorized access or breaches, potentially exposing sensitive information. Ethical obligations to protect patient privacy, even when data is shared widely. Next, informed consent for secondary use. Patients may consent to data sharing for specific purposes, such as treatment. Sharing data for research or public health may require additional consent or informed policies, which can be complex to implement. Next, data ownership and control. Ethical dilemmas over who owns and controls health data, such as patients, providers, and institutions. Respecting patients' rights to access, amend, and restrict use of their information. Next, equity and fairness, ensuring that data sharing does not lead to discrimination or stigmatization of vulnerable groups. Avoiding disproportionate data collection or sharing that favors certain populations over others. Next, data use transparency. Ethically, organizations must be transparent about who has access to data, how it is used, and for what purposes. Patients should be informed and have the opportunity to opt out if desired. Next, balancing public good and individual rights. Public health benefits from data sharing, such as controlling outbreaks. This must be balanced against individual privacy rights. Next, ethical frameworks guide decisions about when and how data sharing is justified. Next, responsibility and accountability. Clear accountability in data sharing processes to prevent misuse or harm. Ethical obligations to address data breaches or misuse promptly and transparently. Next, navigating ethical challenges. Adopting a principle based approach, emphasizing respect for persons, beneficence, justice, and autonomy. Implementing robust governance frameworks and policies that specify data sharing protocols. Ensuring public engagement and consent practices are meaningful and culturally sensitive. Conducting ethical reviews for research and large scale data projects. In summary, while data sharing holds immense potential to advance healthcare and public health, it also raises complex ethical challenges related to privacy, consent, equity, and responsibility. Addressing these challenges requires balanced, transparent, and ethically grounded policies that respect individual rights while promoting societal benefits. Thank you.